Hi, my name is Justin. I'm going to go over a SPECT bone scan. On top of a regular bone scan, you would do a SPECT because you're looking for something in areas that have overlap with different bones, and it makes it a little bit easier to localize where a lesion and or a fracture or something like that is. What SPECT means is single photon emission computed tomography. Basically what we're going to be doing is basically a bone scan, but we're going to be taking it at different angles. The computer will later rebuild it, and that way the doctor, the radiologist can go ahead and look through it at different slices to try to get a better idea of where the hot spot is or where the lesion is on the bones. Now, like I said before, on top of a regular bone scan, some of the reasons you might do this is if they have a patient that has some lesions that show up on their spine. Spine has a lot of bony processes, and sometimes it's a little difficult to tell exactly where on the spine that lesion is. So a SPECT can help the doctor with localization of that. Same thing with the pelvis also. Pelvis, when it's viewed in a planar view, a lot of times the different parts of the pelvis will overlap each other, and it's a little bit difficult to see exactly where the lesion and or the hot spot is. So SPECT helps to eliminate a lot of that. As far as the patient history and indications, basically the same thing as a bone scan. Definitely want to do them if you have a patient with prostate cancer, breast cancer, if they have any lesions showing up again, like I said, on their spine and pelvis. Those are the two areas that it's mainly used for. In later parts of this video, I'll show you the positioning and how we set up the camera for that. So for a SPECT bone scan, what you're going to want to do is bring the patient into we're going to do the area of interest. In this case, we're imaging the lower spine and pelvic region. You'll take them in just so everything's in your field of view. It'll show up nice and bright on your bone scan because the radio tracer that we've given them has already had time to attach itself to the bone. And I'm going to show you in another angle. Basically what you're going to want to do is bring the camera heads in close enough to you get to far enough to where you get good pictures, but also you want to make sure that they clear all the way around the patient. Now to do that, you bring them in and you slowly move them around, making sure it clears all the way around. Now for positioning of a SPECT bone scan, what you're going to want to do is make sure the patient's in the middle of the field of view. The bed's up high enough to where it's going to be in the center of the cameras, because that camera is going to turn 360 degrees around it, and you want to make sure that picture's in the center of the camera the whole time. To do that, basically you're going to bring put the bed in the middle of the field of view. You want to bring the head skin close enough to where they clear around the table, but are also close enough to the patient as possible. Best way to do that is to go ahead and spin the camera to the sides to make sure you have clearance on the sides of the patient table. So it looks like our clearance is pretty good there. We can probably actually bring them in just a little bit. Okay. Go ahead and keep spinning it, make sure it clears everywhere all the way around them. Okay, looks good there. We're going to go back to our start position. Now, other cameras have what's called auto body contouring, which eliminates the need to make sure you clear all the way around. The camera itself will have sensors that will actually sense where the body's position is, and it'll move the cameras in and out to get it to the closest possible position, but also not bump into the patient or the table. So once we have it in this position, we'll go ahead and enter our protocol information. At that time, the camera's basically going to move a step at a time, kind of turn counterclockwise, and it's going to take pictures 360 degrees all the way around. At that point, the computer, once you're done, the computer will rebuild it into an image that the physician can go through and look at different slices and try to get a better idea of where the lesion or the area of uptake is that we're looking at.
This is an example of a process SPECT image. As I'd stated before, when we showed how we position the camera will rotate around the patient, taking pictures at different angles. The reason for this is the computer will then rebuild it into an image that can be divided up into slices. And this is advantageous because it gives the physician a better idea of where the lesion's actually at. If you look at the middle row of the spine, you can see that it's a little bit darker on one side and then a little bit lighter on the other. That'll help give the doctor a good idea of where on the